So I'm back today to talk about shoulder pain specifically. If you have pain on the top of your shoulder, what could be happening? What could you do? Okay. So a couple things I want to explain. Okay. So we have our little model right here. And this is like the back of the scapula, and you have all these muscles here. You have 4 muscles that kind of attach to the arm. Those are called rotator cuff muscles, okay? There's 4 of them, and they keep the arm attached to the shoulder. And then you have 3 bones. You have the humerus, the scapula, and the clavicle, okay? And then you have a lot of tendons and ligaments that keep this thing nice and tight. But there's one muscle on the top here called the supraspinatus that is right on the top, goes underneath this part right here, and goes on the top of the humerus right here. And it attaches to the top of the humerus, and it does this motion right here. So it raises the arm up. It's called abduction, okay? So if you have an injury to the shoulder or severe pain, and you can't do this, there's a chance it could be tore, completely severed, in which case you're going to need surgery. But it could be a partial tear, it could be just trauma, it could be arthritis, whatever. But if you can't do this, if you're like this, then go get it checked, okay? But what I want to do is I'm going to talk about a situation that you can do this, but you just have pain in the top of the shoulder and you're trying to get some relief. So for this demonstration, we're going to have our volunteer, which, Jared, you'd like to volunteer right here, okay? So let's just say, Jared, you have pain in the top of the shoulder, right? And you're like going, what is going on? I need some relief. And then you do this, and you can raise it up, but there's pain right here. So there's a couple things you can do really quick to actually get rid of the pain. If you have someone that's around to do this on you, that's the best thing. But if you're by yourself, I'll show you what to do in that situation. But what you want to do is you want to trigger or do acupressure or a massage to the opposing muscle, to this muscle right here that raises this arm up, okay? You basically want to stimulate the muscle that opposes the supraspinatus. You didn't really need to know that, but I just want to tell you that. And that would be the latissimus dorsi, the muscle underneath here, your lat. Okay, it's a little muscle down here that brings the arm down this way. Okay, so hold your arm really tight to your side. Okay, don't let me pull it out. So if I were to pull this out, okay, I would be testing the latissimus dorsi muscle. Okay, if he's really weak on that, then there's a problem with the lat. But what we're going to do is we're going to stimulate the lat muscle. Okay, so I'm going to show you right here. The latissimus muscle is this muscle that attaches to the humerus, and it comes right through here. It's a really big muscle. So you want to get up underneath, right through in here, right up underneath the armpit. So you want to massage that. If you actually can have someone massage this, we want to come up underneath the arm right through in here. Okay, you're going to massage up and down and really work out that attachment to the back of the arm, right through in here. And you're basically stimulating the lat muscle. And you do this for like 1 minute. Now, it's going to be very, very painful. So definitely when someone's doing this to you, make sure they apologize. And in clinic, I would always go, I'd press in there, and they would be like, ow, ow. And I would go, I'm really sorry about that. I'm so sorry. As I kept going in there. They appreciated that because I was apologizing for hurting them. But when I was done, they were like, wow, I feel so much better. Because what you're doing is you're working on the opposite muscle to relieve this muscle tension right through in here. And it really does work. You have to try it. That's step 1 if you have someone that can work on you. You can just have someone take their thumb and just press up into the armpit and just work that out, okay? That will just take the pain right out of this area. But let's say, for example, you're by yourself, you're on a desert island, and you have no one to do this to you, to put you in pain. What you do is you actually stretch the latissimus dorsi. So you just find like a chin-up bar or a bar you can hang on, you grab your arm, and you basically stretch this way, okay? So you'd want to just kind of hang on it and just really stretch it out. You can also put your hand on a door and just lean down and stretch that, but you want to do this motion right here, that muscle right there. So very simply, to get rid of the pain on top of your shoulder, okay, and we're assuming it's not tore or there's not a major tear, is to stretch the opposite muscle, the latissimus dorsi, or you can have someone massage it and press in there. As far as nutrition goes, you want to do keto, you want to do intermittent fasting, that's going to reduce inflammation, but there's also something called silica that you can take that will support the connective tissue. So you might want to add that into the mix. All right, guys, thanks for watching. So if you want to get notified with all my content, click the notification bell next to subscribed.